All right. Well, good morning, everyone. My name is Dave Medeiros. I'm the president of the Chesapeake Region Safety Council. We are a regional independent chapter of the National Safety Council, and our mission is to educate and influence people to prevent accidental injury and death. Additionally, we are the lead agency with the Mid-Atlantic OSHA Training Institute Education Center. So Region 3, OSHA's Region 3 of the country, we serve as an OTI Ed Center. We are a not-for-profit, non-governmental agency, organization, I would say. And we are also, I'd like to welcome a couple other folks, the MTBMA people that are here, the people from NECA that are here today. There are some people from VPPA here today. So it means I think we hit the hot button with the timely topic. What do you think? And what I always have the opportunity to do when we do this is introduce the CEO of the Chesapeake Region Safety Council, amongst many other hats she wears. But I get to introduce Adele Abrams from the law office of Adele Abrams. And I will tell you, wow, what a great presenter of the topics that we do. She is well versed and understanding. And I guess she probably read all 500 pages of that about this topic, this emergency temporary standard. So I don't want to get on too much. I just would like to say, wow, this is it. And I want to introduce Adele Abrams. I think probably most people know who she is. And without further ado, Adele, have at it.
You're muted, Adele.
Am I unmuted now?
Yes.
Okay, well, we're good to go then. And again, welcome to everybody, and thank you, Dave. This is truly ripped from the headline stuff, and I did a couple of webinars last week or 2 weeks ago before the rule came out, and I was predicting what might be in it. I came pretty close, I think. But as you pointed out, this rule, the pre-publication draft of it was nearly 500 pages. And there's a lot of minutia in there. I have reviewed it kind of so you don't have to, and also the frequently asked questions. I was saying before to my husband before we got started, I condensed 32 pages into 3 slides, but they're pretty heavy slides. So I'm going to try to give you the highlights from that as well. And jumping right into it, though, before we get to the new emergency standard, I just wanted to give a bit of a review and update on some of the other COVID related things with OSHA and a few other developments affecting things. So as we know, everything you knew last year was wrong. I have at least 4 binders of guidance that is functionally obsolete, and some of it is downright, dangerous. But we had a bit of a dust up this spring, where while OSHA was doing their first emergency standard, and it was over literally at Office of Management and Budget being reviewed, the CDC came out and said, the sun's out, everything's fine, dispense with masking for the most part. And that is why that emergency standard ended up being narrowed to just the healthcare sector. When they went in, it was going to look more like the Virginia OSHA rule that I know a lot of you are familiar with on COVID, but it got scaled back. And this is important relative to the new emergency standard, because OSHA has the burden of proving that there's a grave danger that has to be addressed through an emergency standard and cannot, otherwise be managed through the normal administrative procedure process, the rulemaking process. And so, the CDC kind of threw a hand grenade at OSHA back in May. And then they reversed course, and that's where we're picking up here. In July, the CDC, in the wake of the Delta variant, changed its guidance. OSHA then, in turn, updated its guidance in August, and I'm going to give you just a couple of highlights from that here in a moment before we get into the vaccine and testing rule. 2 other things happened just in September. We had Executive Order 14042 issued by President Biden. And that one is a vaccine mandate. I want to be real clear. The emergency standard we're going to talk about is not a vaccine mandate. It is a vaccine or testing mandate. And that nuance from a legal perspective and functionally is very important. But for federal contractors at a certain level, you do have to be fully vaccinated. And so I am, after we talk about the vaccine emergency standard, I am going to go through that because I know a lot of you on this call are government contractors. They also, the same day, President Biden issued Executive Order 14043, which also requires a COVID vaccine for all federal employees. And of course, with all of these, they do recognize that there are medical conditions where people cannot safely get the vaccine. There are people with the Americans with Disabilities Act conditions that would be covered who cannot get the vaccine. And then there's, and those are a nuance, by the way. I'll get to that a little bit later. But there's some people who can't get it, period, hard return. There's some people who can't get it right now for specific reasons relative to having just had a COVID positive test or a COVID diagnosis. And those will have to ultimately get rolled into the programs, but they have a bit of a grace period for safety reasons and for efficacy, frankly. So the vaccine issue for the federal employees, unfortunately, I'm not going to cover that in this webinar. There just is not time, but anybody who's a federal employee who needs information on that, certainly contact me offline. Now, another big development in the timing of everything here is that Doug Parker, the former head of California OSHA, or Cal OSHA, had been nominated to head OSHA, but had not yet been confirmed. And that finally happened on October 25th. And so now I think they were waiting for that to happen. It was close in order to release this emergency standard so that they would have somebody who could be the spokesperson for it, basically. So as a result, this brings us, to current times here this month. The emergency standard that OSHA issued on vaccine and testing was published in the Federal Register on November 5th, and it took effect immediately. And before everybody goes, wait a minute, that's not what I heard. There's legal stages of this. By saying it's effective immediately, that froze in time a couple of components, and we'll talk about those later, but having to do with the size trigger. But most of the elements of this are going to kick in a month from now, in a month from the publication date in December. And then the actual fully vaccinated and testing regimens, that goes into effect in January of 2022. So there is some lead time here. And there also, of course, are legal challenges to it. Now, one of the things I want to note is that the litigation, I literally, was monitoring the news this morning to see if I had anything to change. The stays have been put in place, and there's been litigation filed by the I'm just going to say the business community. It's not the whole business community. A lot of business groups actually supported this because it gives the employer a bit of legal cover for demand. If they want to impose a vaccine mandate, it allows them to do that fairly safely and point to an OSHA rule. But also the unions have sued over this. Now, you may be saying, why did the unions sue? They got everything they want in a bag of chips. Well, there's a couple of reasons. First of all, the grounds that the unions are suing for have to do with the scope of the rule. We're going to get into all the details of this in a few minutes here, but the Reader's Digest version is it only applies to employers with 100 or more workers. Well, that leaves 40 million American workers uncovered by this emergency standard. And on one hand, that undercuts OSHA's arguments a little bit. If it's an emergency, a grave danger, why is it not a grave danger for all employees? Also, there have not been size exemptions on true safety and health standards before. Record keeping, yes, but this is certainly a different approach where you can say, kind of the animal farm, all animals are equal, but some are more equal than others. All workers get protections, but some workers get more protections than others. And I think the unions have a fairly strong argument on that one. Also, we're going to talk about this a little bit more, but the issue of who pays for the testing of unvaccinated workers. And currently, again, short answer, spoiler, employers do not have to pay for it unless their collective bargaining agreement or other contractual documents provide otherwise. But the unions are saying, look, masks and testing are all part of the worker protection components of this rule. And therefore, just like PPE, the employer should be required to pay for those. So those are the issues that are going to be litigated by the unions. The business community, of course, is generally saying undue hardship, infeasible, and most significantly, that OSHA has not shown that there is a grave danger that will be mitigated by this rule. So those are kind of the things going on. But there's something else, a bigger issue going on. The business groups filed in very conservative circuits, the Fifth Circuit, Sixth Circuit, Seventh Circuit, and Eighth Circuit. And then the union groups, they filed in, no surprise, the liberal circuits, I believe the DC Circuit, first, second, third, and fourth circuit. So the country is almost split, just like on everything else by its circuits. And so what happens now, and again, this is for the lawyers on the call and anyone who's interested in this stuff, they're going to have a lottery. Yeah, really, like pick a number out of the hat. And by the unions filing in all those circuits, they did that intentionally to increase the likelihood, or at least, balance the scales in the hopes that one of the more liberal circuits will be picked for that, which would be more likely to sustain this rule. Now, if the rule is invalidated, it will go to the Supreme Court. If the rule is upheld, it'll probably go to the Supreme Court. But because of the nature of this being an emergency standard, people have been asking me, well, do I think the stay will hold? And no, I don't. I mean, this is a pandemic, and just like we say, justice delayed is justice denied. An emergency safety standard that is delayed is in effect no longer an emergency standard. So that is an interesting aspect of this. Another interesting aspect, and we'll go into this a little bit more, is that some of the state plan states, not Virginia or Maryland currently, have been saying, oh, hell no, we're not going to do this. And OSHA said, oh, hell yes, you're going to do this. Now, so far, Arizona just blinked and South Carolina just blinked. But there's been some saber rattling, from some of the others. Some of the federal OSHA states, Florida and Texas, I believe, among them, have said that they're going to withdraw from federal OSHA. And, it doesn't work that way. If they withdrew from federal OSHA, it could only be because they had an equivalent state program, and that would have to be approved by federal OSHA in the first instance. So there's a lot of saber rattling going on. I saw one of the candidates for governor in Arizona yesterday was saying, if I'm governor and federal OSHA shows up here at the Bay Harbor airport, I'm going to have them arrested. And I was laughing because federal OSHA already has offices in downtown Phoenix. So, don't take a lot of what you're reading out there to the bank in terms of this rule being at high risk. It could happen, but my money is on it being sustained. The other thing I wanted to mention before we move off of this slide is that there is, and this is counterintuitive, I know, but there is a comment deadline on this emergency standard that already took effect last week. The reason for that is when they publish an emergency temporary standard, it's only supposed to be in effect for 6 months from its effective date. But they can extend it out by making it a permanent rule. And so this serves as a proposed rule concurrent with the emergency standard. So for the organizations that are on the call, and I know there are quite a few of you out there, comment time. If you do think that these kind of programs we're going to talk about should be a permanent thing, kind of a quasi-infectious disease rule, let OSHA know that. If you think that this should sunset at the end of 6 months, let OSHA know that. Another big development relative to all this guidance, and I'm not going to go through a lot of the OSHA guidance in detail, but they have now in their policy recognized a category of at-risk workers who are fully vaccinated, but they're, because of underlying health conditions, they may not have had a full immune response to it. Those are people who've had transplants, heart transplants, liver, kidney, lung, people who are using steroids, and those are used for a variety of conditions, everything from, you know, asthma to fertility treatments. There's also people who have underlying immune conditions, things like lupus, fibromyalgia, rheumatoid arthritis, scleroderma. All of those individuals are urged by OSHA to get a booster now if it is safe for them to do so, because again, that they may be at higher risk, and they're assuming because they're fully vaccinated that it's safe to go around unmasked. So OSHA is saying for those at-risk people, basically treat them as unvaccinated in terms of social distancing, in terms of wearing face coverings. Also, very briefly, just to remind you, I'm not going to do a deep dive on this today. OSHA still has its national emphasis program out there. That took effect on March 12th. It was scheduled to be in effect for a year. It can be amended. It has been amended once already. And this focuses on high hazard industries. This is not limited to the healthcare sector. And in fact, the first employer who got cited, and it was as a willful for 136 grand, was a tax preparation company, because they had their, you know, they weren't doing distancing, they didn't have barriers, they weren't letting people wear masks, and so they had the hammer dropped on them. The goal of this, obviously, is to reduce worker exposure and transmission. But one of the novel aspects of this as a national emphasis program is that it has a whistleblower component. And so if OSHA shows up at your site, they're not only going to be looking at your COVID programs and protections, but they're also going to be talking with the workers, letting them know what their rights are under Section 11C of the OSHA Act, which 30 days to file a retaliation complaint with OSHA, but also under the expanded rights in the electronic record keeping rule, 29 CFR Part 1904.36. Where they incorporated by reference Section 11C. And that now is 180-day statute of limitations. So if a worker, say, is retaliated against, under this new COVID rule, they could notify OSHA about that even after that 30-day deadline passed. And then OSHA has 180 days to investigate, cite the employer, issue them a penalty of up to $136,532, and then the abatement would be reinstatement of the worker, or, you know, purging of discipline, et cetera. And so, you know, you are going to get let me rephrase this, you are, when this new rule now is in effect, you're going to get complaints from workers about it. And, you know, some of those may be safety related. Be careful. There is a fine line. I have this in the FAQs later, but you know, dealing with unvaccinated workers, you have to watch how it's going down, and the guidance on this that I'm going to get to will be very important. But if people raise concerns about how you're implementing your COVID protections, take them seriously. Also, if they phone in a hazard complaint to OSHA about that, it'll be a priority in terms of their inspection protocols, you know, which ones they get to. National Emphasis Program is on the lesser end of things because it's a programmed inspection. But the other thing is, if your work site is already in a high hazard industry that might have been on OSHA's site specific targeting list due to your DART rate, and your number comes up to be inspected under this COVID national emphasis program, they're going to do them concurrently. So you're going to get not only the deep dive on COVID, but you will also get a wall-to-wall inspection under the site-specific targeting program, including a record audit. And then finally, there are work sites that were inspected last year. I represented some of them due to COVID complaints. In some cases, they got citations. And OSHA is going to circle back to those work sites where they can to make sure that the abatement measures are being maintained. And, you know, it's a lot of money per day for failure to abate. So if OSHA comes in, they find that you relaxed your protocols without justification, they can cite you on a per diem basis dating back to whenever you signed the settlement agreement. So those are some trapdoors you have to watch for in that national emphasis program. Also, OSHA issued, as I mentioned, new guidance in response to the revised CDC and NIOSH guidance. And this is the latest that they have out there. Most of this and really because we have a lot to talk about, in the interest of time, I'm not going to go through all of these with you, but this is a good one to snapshot. And the one I will note, and I've got an asterisk on it, is number 9 on reporting and recording of COVID infections and deaths. That has been changed by this new emergency standard and the guidance that OSHA has issued for it. So I'm going to talk about that in detail in a few minutes. But if you had already, based your program on what to report on the Trump interpretation, which basically said don't report any hospitalizations because, nobody is hospitalized within 24 hours of the virus going up your nose or into your eye. That is no longer good law. So get rid of those policies if you had adopted them. And also, just to recap on number 11 there, OSHA still, in addition to these emergency standards for the one for healthcare, and then the new one that we're going to be talking about in detail on the vaccine and testing requirements, OSHA can cite you under the General Duty Clause, Section 5A1 of the Occupational Safety and Health Act, generally for having recognized hazards that affect can kill workers, and that you have not implemented abatement where it's feasible. And these standards and these guidance measures show that there are feasible steps you can take. So that's a significance here under the General Duty Clause for numbers 1 through 10. But also PPE hazard assessment. This is a trapdoor a few of my clients have been cited for, where you have your existing PPE written hazard assessment under 29 CFR 1910.132. You're looking at the task and you're looking at the PPE that's required. OSHA expects that you've revised those to consider COVID hazards and added things like respirators or face masks to your PPE written inventory. And of course, that has to be revised every year. So please make sure you're doing that. They can also cite for improper use of respiratory protection. Very often the trapdoors there are not having the fit testing, not having the medical evaluations, not having the paperwork on them, people wearing them over facial hair that's too long, et cetera, not knowing how to clean and restore them. Sanitation, having the at least tepid water and cleaning supplies so people can wash their hands. Bloodborne pathogens, OSHA put that on their list because there is a bit of crossover, even though this is not a blood transmissible disease. And then finally, medical and exposure records. And this is, again, I'm going to go beep, beep, beep. I should have probably put an asterisk on that one too, because the medical and exposure records, they're all over the place, as you know. Some of the stuff you have to keep for the period of exposure plus 30 years. There are some carve outs for construction for people who are with you less than a year. Medical surveillance records fall in there. So what about vaccine records and what about testing records? They are covered now under this medical and exposure records rule, but I have this a little bit later, but I want to capture it while we're talking about this. You do not have to keep them for the period of employment plus 30 years. You do have to keep them for the period that this emergency temporary standard is in effect. And remember, if this emergency standard becomes a permanent rule, then they're likely to change that in terms of the duration where you would have to keep those records. So some of this guidance is ultimately going to end up a bit in conflict, depending upon whether you're looking at vaccine records or whether you're looking at medical surveillance records, et cetera. Also, and then we're going to be getting on to the main event here, OSHA issued new guidance for what they're calling mixed vaccination status workplaces. Now, I'm going to go out on a limb and say most of you on this call are probably mixed vaccination status workplaces. And the reason this slide is so important, this is another one to bookmark, is that they discussed in here workplace environmental factors. This is going to come up again in the new emergency standard for the vaccine and testing. And so when you are analyzing under the new rule and considering workplace environmental factors, this is what OSHA is talking about. You're going to be looking at, is there close contact where unvaccinated or at-risk workers, remember those are people who maybe have been vaccinated but have the transplants, steroid use, or immune disorders. Are they working close together? Are they, elbow to elbow on a production line? Are they working in a public-facing job in a retail setting? Are they near each other when they're clocking in, when they're changing, going to the head? What's the duration? Because having contact, if it's brief, we all know that, OSHA was looking, or to me, NIOSH had been talking about it being more than 15 minutes in a 24-hour period. So, that's still kind of out there as something as you can benchmark to. But OSHA wants to know, wants you to consider, is there going to be contact, say, for 6 or 12 hours on a shift? Are you just going to be passing in the hallway or in the bathroom? The continued contact increases the risk. And so that is going to require more precautionary measures. Also, the type of contact. And they're going to be paying special attention to things like confined spaces, exposure through contaminated surfaces. You can buy Lysol and other cleaning products in the supermarkets now where we couldn't, this time last year. They do still want you to be sanitizing your tools, your equipment. If you have shift changes and somebody else is going to be sitting at a workstation, do the telephone handles if you're using those. Everybody can have their own headset, and that helps to mitigate that, but you're still going to have to clean things like computer keyboards off. Also, be mindful of mobile equipment, construction, mining. Again, if you have multiple people who are going to operate a front end loader during a shift, it should be sanitized or at least disinfected in between. Also be mindful not only of the shared break rooms and locker rooms, but shared transportation. Several of my clients have had outbreaks that are directly traceable to this. And, it has a ripple effect. One person in the van has it, then you have 5 people in the van that have it. And then those 5 people are working in different areas of your operation. So these are all, then, they in turn can infect other people. And the rule does not require you to do contact tracing, but if you're trying to determine the work relatedness of a case for OSHA reporting purposes, which is again where this analysis of workplace environmental factors comes in under the vaccine and testing rule, you're going to have to consider all of the possible routes of transmission in the workplace, as well as looking at the bigger picture. What is the transmission rate in your community, in your county, for example, or in your city? Now, the other thing here is, how is OSHA enforcing? When they come in, they're going to be looking at your safety gear. They're going to be talking to your workers. And again, talking about workers' rights is likely to be part of that dialogue. They're going to determine, does the standard apply to your workplace? And one of the things that I'm going to talk about a little bit more about this emergency standard is there's a new requirement to keep an aggregated roster. First, to keep a roster of all of your vaccinated people and the testing that's being done. But then you have to keep an aggregated count, the total number of fully vaccinated employees and the total number of employees. So that's going to be a ratio, a percentage. OSHA's going to ask for that when they come in. And if your rate of vaccination is quite high, then you're going to get a very truncated, an abbreviated inspection. They have a lot of latitude in there. On the other hand, I have a client with a 14% vaccination rate right now, and they just had an outbreak involving 10 people. no big surprise there. But if OSHA comes in and you've had a history of outbreaks or you have low vaccination rates, they're going to do a more thorough inspection. They're going to be examining your programs in greater detail. And that would be found, to probably result in some citations, I would imagine. If they're looking at, you having a high vax rate, less stringent protections are going to be needed. Also, if you hire new workers, and we're coming on the Christmas and holiday season now, a lot of the retail stores are very aggressively hiring people, and they may not be fully vaxxed. If you had area exemptions where you could relax things because everybody was vaccinated, and now you're bringing in new workers who are not vaccinated, you're going to have to reevaluate your whole program, and you're going to probably have to put some of the barriers, the distancing, and masking restrictions back in place. All of OSHA inspectors will acknowledge and recognize, and expect employers, in fact, to recognize that workers who are unvaccinated due to health conditions or religion will be allowed, but the employer is going to have to provide reasonable accommodation. And OSHA wants you to consider, can that person telework? We just went through last year, proved that probably a third of us anyway can remote work. What about solitary work? Can they be put in an office where they don't interface with other people? Maybe that's considered rewarding, a position that should be discouraged. I'll leave that to you to decide. There may be implementation of controls just in areas that are dedicated to unvaccinated employees. All of that, you have flexibility as an employer, and OSHA, wants you to consider all those tools in the toolbox in terms of accommodating workers who are unvaccinated due to religion or health. But you don't have to accommodate unvaccinated workers who don't have those legal protections. And in fact, and again, spoiler, OSHA does not mandate the vaccines other than for the government contractors. But if an employer wants to mandate the vaccine, OSHA is okay with that. You do not have to give your workers the testing option. You can, but it's not required. So that is, again, a flexibility that I think the business community had been asking for. Also, in terms of general screening, and I'm not talking about the COVID testing now, I'm just talking about the temperature checks and the questionnaires. You can do, pretty much as you wish there, but I will note, we still have, probably a dozen or more state executive orders that are in effect that have these kind of screening requirements. And I live in Delaware now. Even between Delaware and Pennsylvania, they had differences a while back where one of them, Delaware, you had to withdraw people if their temperature was 99.5, but that's in Wilmington, and then across the river in Philadelphia, it could be 100.5. And so there may be variations. There may be, more detailed requirements at the state level that you're going to have to pay attention to. And of course, again, for those of you who are under Virginia OSHA, please do not forget that they have an extremely, extremely detailed COVID-19 permanent rule. The last bits of that took effect last month, and I sat through a 4-hour class on that. I think Chesapeake Regional Safety Council put it on, and I came away, boy, my head was spinning. So if you are working in Virginia, as a base of operations, or you have crews that work there, please understand that that is much more stringent than the federal OSHA rules, and I'll leave it at that. Speaking of which, there's also Cal OSHA. They still have an emergency rule in effect. Oregon OSHA adopted a permanent COVID rule. They made some changes, and they had been saying if they reached 70% full vaccination in the state of Oregon, they were going to rescind it. Then the Delta variant came, and boosters clearly have complicated the issues. But again, spoiler, the COVID rules, both for contractors and then the vaccination for general private industry, the pay and the other requirements only apply for the first, they call them the primary shots. For Pfizer and for Moderna, that would be 2 shots. For Johnson & Johnson, it would be 1. As of now, the OSHA Emergency Standard does not envision any kind of requirements for any kind of boosters, even though they are recommended for everybody over 65. And now they are recommending them really, I think very shortly, for everybody 18 and up who got vaccinated in full more than 6 months ago. So keep an eye on that changing policy too. Michigan OSHA, their rules actually are still in effect, a little bit of a sleeper, until December 21st, but they could extend that out again. And then Washington OSHA, WISHA, they just proposed a rule this summer, and Nevada OSHA issued a new COVID policy in May. So as you can see, there's still a lot of action going on in the backfield with the state plan states. And for those of you on this webinar who do operate outside of our little region here, you really need to make sure that you're updating your programs to stay in sync with these more stringent and unique state OSHA requirements. Beyond that, as you know or may know, there's over a dozen state orders, as I mentioned, and New York State, getting frustrated with federal OSHA, had gone ahead and had their health department issue workplace safety rules for COVID. Amazon sued the state of New York over that, claiming that federal OSHA has exclusive jurisdiction over workplace safety and health, and that bars state health departments from getting into the act. And they lost. They appealed it to the U.S. Court of Appeals, but now it looks like that case may be moot because of the federal rules changing, et cetera. So, but that was a huge issue because that really opens the door on almost any issue, whether it's ergonomics, workplace violence, or heat stress, for the state health departments to jump in a federal OSHA state where federal OSHA has not taken a role. So stay tuned, but that is a very interesting and fairly large OSHA issue. So now to the main event. Ta-da, I feel like I should do a drum roll here. The vaccine and testing emergency temporary standard. This is being considered a safe workplace measure. And so it is not a pure vaccine mandate. It covers 84 million workers and it leaves out 40 million workers. So, you know, you can see where the unions are coming from. If you're leaving out a third of American workers, it might be hard to justify that. Some of the basic requirements here: employers are going to have to provide paid time off to receive the vaccine and to recover from the side effects. And again, I know you're thinking, how much time? We're going to get to that a little bit. Unvaccinated workers must wear face coverings indoors. That is a non-negotiable thing, except in very rare circumstances, if you can show that it would pose a greater hazard to wear the face covering, or if you're already wearing a respirator, say for silica. That would be an exception there. There are a few exceptions. We're going to go through all of that. The mandate for all workers to either be fully vaccinated or begin testing on a weekly basis and have a negative test in order to enter the workforce that week, that takes effect January 4th, 2022. And so I want to note the temporary stay that is in effect right now, and I think that all of the briefing and decisions on that, you know, are going to probably be made in very short order this month. The first kick-in dates are December 5th, but the vaccine and the testing, you know, there is enough time for this to be fully litigated, even if there is a stay, and still have these things ultimately take effect as soon as the stay is lifted. And so, you know, as Clint Eastwood would say, are you feeling lucky? You can start implementing this now on a voluntary basis, making sure your workers get in the queue for getting vaccinated, because you have to, you know, reverse engineer from that effective date. And really, if people are going to get the 2-shot sequence, they have to abide by either the 21 days in between for the one, or the 28 days in between for the other, which means that you're running out of time to get that first jab in your arm. Now, for the Johnson & Johnson, the 1 shot, that gives you a little bit more time, because to be fully vaccinated, you've got to have all of the sequence plus 2 weeks. So again, back time from that, you know, by the holidays, you're going to have both of your shots, or at least the first shot, the one shot of Johnson and Johnson. This rule specifically, OSHA says, preempts any inconsistent state or local laws that are less stringent, and that includes specifically any laws that ban or limit the employer's authority to require vaccines, to require masking, or to require testing. Yeah, we're looking at you, Florida and Texas. Also, the employer is going to have to document the vaccine, the test, or the exemption. For legal reasons, there are going to be requirements for that. So it's not, kind of like now where you can just look at somebody's card and go, okay, that's cool. You're going to have to make a copy of it, and you're going to have to keep a file on these things. And these are the records that are going to be considered under the Medical Records Access Rule, 29 CFR 1910.1020. As I mentioned, the unions are suing over the need to cover everybody and the testing payment requirements. But as of now, as of the verbiage in the Emergency Temporary Standard, employers would pay for the vaccine if there is a cost. Excuse me. But they will not have to pay for the testing unless they have another contractual reason to do so, or legal reason to do so. And, for somebody who can't get vaccinated under the ADA for health reasons or for religious reasons, those are circumstances where, as a reasonable accommodation, the employer likely would have to pay for that testing. So don't forget, that there are going to be some carve-outs on that. Now, they're going to enforce this through their usual inspections. Complaint-based inspections will take priority. That is hazard complaints where somebody says, we've got COVID in the workplace and the employer is not testing, they're not making people test or get vaccinated or wear masks. And it's also going to be retaliation complaints under either Section 11C or under 1904.36. But the National Emphasis Program, if you're inspected under that one, they're going to be looking at what you're doing under this. And I would add, quite frankly, if OSHA comes in for any kind of inspection, going forward here while this is in effect, I think they're going to be talking to your employees. They're going to be asking about this. They're going to be asking workers, are you vaccinated? No. Okay. Are you testing weekly? No. Okay, that's interesting. And then they're going to come down on you. They will expand the scope of the inspection to include COVID. They do have the right to do that. As I mentioned, the penalties can be up to $136,532. But one of the, to me, interesting aspects is they are now talking about resuming egregious penalties. And that is where you get a separate citation and a separate penalty per exposed worker. So if you have 10 people in a work area with where there are some unvaccinated workers and you have not been following the testing protocols, they could do 136 grand times 10. Now you're into, the mega millions jackpot here. They did not use the egregious penalties in the Trump administration, to my knowledge, at all. But this is something they did do in the Obama administration and in previous ones. So be cautious about that. This can get very, very expensive. I wanted to note that OSHA has provided translations for all of their guidance in Spanish. They also have templates, very useful stuff that you can use for developing your rosters. And I'm going to talk about what those entail here, and also waivers that employees can sign, etc. So take a look at those documents. Can you use your own? Do you have to use what OSHA's given you there? Of course, you can use your own. In my experience, if you're using OSHA's own forms, it's harder for them to ding you on a paperwork violation. And at least it suggests that you've read the rule, you've gone to their website. Excuse me, that earns you some brownie points. I've given you the link there. And as I mentioned up front, there's 32 pages of frequently asked questions. Again, I've gone through those, so you don't have to, but I have not covered everything, obviously, as we go forward here. There are some really detailed answers that they give. So if you have unique considerations, take a look at those. For example, and I will talk again about this, outdoor work. If it's exclusively outdoor work, it's exempt. But who is exempt? Who is considered exclusively outdoor? There's a little bit more to that than you would imagine. So with this COVID vaccine and testing rule, for any emergency standard, actually, OSHA has to show there is a grave danger that justifies bypassing the whole normal rulemaking process where they put out a proposed rule, there's comment, there's public hearings, there's an extended implementation period. The injunction that's in effect right now is with the Fifth Circuit. And in responding to that, OSHA filed its brief this week. Their rationale for the grave danger support is that unvaccinated workers are much more likely to contract and transmit COVID than vaccinated workers. And yes, I am aware that vaccinated people can be positive. In fact, a friend of mine's husband who was fully vaccinated died of COVID breakthrough pneumonia in Silver Spring back in September. I know several other people who have had breakthrough cases that required hospitalization, even though they were fully vaccinated. And certainly, as we've noted already, anybody who is at risk for fully vaccinated is indeed at risk of getting it. But there was still a study that came out earlier this month indicating that the vaccine does have efficacy in terms of preventing transmission. So that is one of their justifications. They found that unvaccinated or not fully vaccinated workers are still facing grave danger from exposure. And, they can still point to 750,000 people who died. Yes, I know a lot of them were elderly, but there are a lot of older people who are still in the workforce, like me. And I suspect some of you on the call as well. And so, this hasn't gone away. We're still having, over 1,000 people a day dying from COVID. Also, the grave danger finding is based on the severe health consequences after you get COVID. And I'm going to talk about that at the end here because, again, spoiler, the EEOC has now classified long COVID as a covered condition under the Americans with Disabilities Act because it impacts major life activities. And so all of your workers who've had COVID, if it's work related, they may ultimately have permanent partial disability claims using the ADA criteria under workers' comp. So, employers do have a vested interest in making sure that their employers do not contract COVID on the job. Beyond that, there's a lot of evidence. I'm not going to go into the epidemiology here, but look at Section 3A in the preamble to the November 5th emergency standard. And you can look up these studies to your heart's content. The bottom line in justification of the rule, OSHA says that the emergency standard will save over 6,500 workers' lives, prevent over 250,000 hospitalizations. And those people who are hospitalized with COVID, most of them do come out with some level of long COVID. I've had even several relatives who've had COVID and were hospitalized for it, and they're still suffering the after effects even a year later. So who is covered by this rule? Private sector employers with 100 or more workers, firm or corporate wide. Now that means if you have 15 or 30 people or 85 people at a work site, but you're part of a larger company, you're going to be covered. This conflicts with the electronic record keeping rule, which does the exact opposite. And they look at the number of people per work site as the trigger for submitting your data online. So don't get those two confused. Now, if you're in a state with an approved OSHA plan, you're going to cover private sector employers and also state and government employers with 100 or more. Now, it excludes private workplaces with fewer than 100 employees company-wide. It excludes public sector employers if you are in a federal OSHA state. So that would be DC, it would be Pennsylvania, it would be West Virginia, it would be Delaware. So under Chesapeake Region Safety Council, we have a mix. We have Virginia, and Maryland, which are state plan states, and the rest of them are federal OSHA. And so public sector are covered in Virginia and they're covered in Maryland, but they're not covered in the rest of our states here. Also, this is the good news, I suppose. If you're covered under the COVID guidance, the executive order for contractors, you follow that. You don't have to follow the emergency standard. And then if you're covered by OSHA's emergency temporary standard for healthcare workers, the one that came out back, this spring, you just follow that and you're not covered by this either. So again, they're not double dipping there. That's good news. Also, the emergency standard does not cover your employees who do not report to a workplace where other individuals are present. So if they work exclusively from home, maybe they're a salesperson, or they're doing computer stuff, all online or by telephone, they don't have to be vaccinated. They don't have to be tested. If they were in a remote, a trailer, I had somebody who was assigned to work by themselves in a trailer, don't ask why, they wouldn't be required to be covered by this. And then if you work exclusively outdoors, there is a de minimis indoor presence exemption. So you're allowed to, go inside to use the bathroom or to go to an administrative office briefly. But when you do that, and again, this is in the frequently asked questions, you're going to have to not be vaccinated, but be tested before you go to that work site. Not to go in and out of the bathrooms, but if you're going to be there to work periodically, that's a different story. But exclusively outdoors, this is going to be, your lawn care and your tree trimming services. What about construction? I can read your mind. You're thinking that. Construction outdoors is exempt. But they say buildings that are partially constructed, where the roof is on, preventing the flow of air, then that is not considered to be an outdoor work environment. So you're going to, again, have to be real careful. Interestingly, I litigated, we ended up not going to court on it, but OSHA had cited one of my employers in Maryland. This was Maryland OSHA, under their indoor smoking ban, which they have, but federals don't. And it was in a house that was partially under construction. And I got them to agree that the indoor smoking ban didn't apply because the building didn't have all the walls and the roof on it. This is a different approach that they're taking here. So be careful about that, boys and girls. So what do you have to do under this rule? You have to develop, you have to implement, and you have to enforce a vaccine policy, or you can adopt a policy allowing workers to either be vaccinated or undergo weekly testing and wear a face covering in the workplace. The vaccinated workers do not have to wear the face covering if they're fully vaccinated, but the unvaccinated and partially vaccinated people will. The employer has to determine the vaccine status of each employee. You're going to have to keep a roster of this. You're going to have to get acceptable proof from the employees. That means legitimate cards. You're going to have to maintain the records of these cards. You're going to want to support, you have to support vaccination by giving workers who opt for the vaccine 4 hours of paid time off to get the vaccine. And that's for each primary dose, not the boosters, but the first and second for Moderna or Pfizer, or the only one for J&J. You have to give them reasonable time and paid sick leave to recover from any side effects. What is that amount of time? It's not real clear right now, but probably a couple of days. OSHA guidance does say that if somebody had severe complications, for example, requiring hospitalization, for an extended period of time, you would not be expected to pay for that. You also have to make sure about this testing that every non-vaccinated or persons who are not fully vaccinated, they are tested weekly if they're going to be in the workplace at least once a week. Or if they're not normally in the workplace, they have to be tested within 7 days before they can return to the workplace, if they're going to be doing periodic work. Also, they have to promptly notify you if they're positive test or if they are diagnosed with COVID. And anybody who has either of those has to be immediately removed from the workplace, regardless of whether they're vaccinated or not, until they get a clear test or they meet the return to work criteria. There is some guidance I'm not going to have time to go into, but if you are vaccinated fully and you get a positive test, because there are some rates of false positives, there are certain tests that they accept as a confirmatory test. And again, this is detailed in the FAQs. The fully vaccinated person can opt to go and get a second test right away, within a couple of days. And if that's negative, they can go back to work right away. They don't have to quarantine or isolate for the period of time that somebody else who is unvaccinated would. So again, there are some different criteria there. You have to make sure that everybody who is not fully vaccinated is wearing a face covering indoors or when they're occupying a vehicle with another person for work purposes. And there are some carve outs if everybody is a family member, for example, a household member. Provide workers with information. This is training. That's another word for training in a language and a literacy level that the worker will understand about the following. You have to train them on the requirements of the emergency standard. You have to train them on your workplace policies and procedures to implement it. You have to train them on the vaccine efficacy, the safety and the benefits of being vaccinated. I know this is going to stick in some of your throats. If you don't want to talk about it, you can give them, excuse me, the CDC document, key things to know about the COVID vaccines. You also have to train your own workers on protections against retaliation and discrimination under Section 11C and under 1904.36. And then this is the kicker here. You have to train them that the law provides for criminal penalties for knowingly supplying false statements or false documentation. And I'm going to go into that a little bit more here in a moment. But that goes both ways. If an employer knows that workers are giving them fake cards and you're accepting them, you can be criminally prosecuted as well. And you get more time in prison for giving false statements or false documentation. Now remember, you have to show these cards to OSHA too. You get more time in prison for that than you do for a willful violation that's causally connected to the death of a worker. So consider that. And if you're in conspiracy with your workers to tell them where to go get some fake cards, for example, that is a separate violation, not under the OSHA Act, but under 18 U.S. Code. You can go to prison for up to 20 years for that. So think twice before you decide that you're going to be oh so smart and get around OSHA somehow on this. Also, the employer has to determine for reporting and reporting purposes if a COVID case is work-related. And how are you going to do that? You're going to do that by considering the work duties and remember the work environment. That slide that I spent time on earlier that talked about looking at the close contact, the duration, sharing equipment and vehicles and tools, etc. That is the triage you go through. And if the tiles are flipping where, there is that potential for it to be work related, you're going to have to notify OSHA and it's going to have to go on your logs. And then, as I mentioned, the aggregated basic data, the number of fully vaccinated employees versus the number of total employees at the workplace. And that is where OSHA is going to make that determination on whether to really tear you a new one or whether to give you more or less a pass on an inspection for COVID. Reporting. This is very important because this is the big sea change from the Trump administration. As of now, and again, remember, this took effect November 5th, you have to report work-related COVID fatalities or COVID inpatient hospitalizations, regardless of the amount of time between the exposure to COVID in the work environment and the death or hospitalization. So this, again, flips even the basic codified severe injury reporting rule, which is 1904.39, which says that to report an inpatient hospitalization, amputation, or eye loss, that injury or illness has to have occurred within 24 hours of the triggering event. So, to use, say, a burn, somebody burns their hand badly, they go to the ER. That's not inpatient hospitalization. They're released. 3 days later, their hand blows up with an infection. They go back and they're hospitalized at that point. That would not normally be reported to OSHA because the hospitalization occurred more than 24 hours after the burn. But here they're saying it does not matter now. And on the death, normally you only notify OSHA of a fatality if it occurs within 30 days of the triggering event. Here, that doesn't matter. And people sometimes, are in the hospital with COVID for a couple of months before they die. So if you notify them initially about the hospitalization and then they die later on, you're going to have to notify them about that. But if you find out about it all at once, they're hospitalized and then they die, a single report will suffice. They do clarify that in their guidance. Beyond that, all employers covered by the emergency standard have those reporting requirements. It's unclear at this point, if you have fewer than 100 employees, what criteria you're going to use if somebody is hospitalized with COVID. My recommendation, though, is go ahead and report it, because if you're supposed to report it and you don't, it's a mandatory minimum $5,000 penalty for OSHA. How do you report it? You can do it by calling the local OSHA office. I don't recommend that. You can also call their hotline. I also am not a big fan of that, and it should be 321 OSHA. I had a typo there, sorry. What I've been doing with my clients is using the portal, and you can type out all your information about your fatality or your injury report. But before you hit send, do a screenshot and have the lawyer look it over, because very often I have to do a little bit of editing just to take out extraneous information. You don't have to admit to violations in the course of reporting a fatality. If they show up, they'll do their investigation and then they can decide. But at least by doing the report online, you're not opening yourself up to a flurry of open-ended questions that you might not be prepared to answer in real time. So now another component of this, and I know people are sick of doing plans. You just finished doing a bunch of the Basilica, and now here you are with more. This program, though, if you are covered by it with 100 or more workers, you have to have a written program detailing how you're going to implement your vaccine requirements or your testing and masking protocols, if you're giving that as an option, the applicable exclusions for health, ADA, and religion, how you're going to collect the information. You can accept, somebody can show you the hard copy of their card. They can show you a digital copy of it. Some companies are using services that may or may not be allowed. You're probably still going to have your roster. But I just spoke at a conference literally this week. I had to send them my cards through a portal. And then I also had to do a self-administered test with an online proctor watching me. It was a weird experience, but that's how you're going to have to do those tests. If you're allowing the self-testing, you're going to have to use a proctoring service, or the employer's going to have to monitor it, watch it physically, just like they would with a P-test, I guess, in a sense. You're going to have to include the paid time off rights and sick leave policies for vaccinated workers, how you're going to handle notification for positive tests and positive diagnoses, and the removal of those workers. And some of this you're going to be negotiating with your unions, I'm sure. Disciplinary action for workers who do not abide by the policy. Yes, you can discipline workers who don't wear masks if they're not vaccinated fully. When your policy is taking effect, and again, you can put this into effect ahead of the OSHA deadlines. There's nothing wrong with that. Who it's going to apply to should be everybody, but keep an eye on that. The deadlines and the procedures for compliance and how you're going to enforce your policy. Remember, these plans, they have to be in writing. So they have to be accurate. You can't show OSHA a fake plan that you're not following, but you don't have to submit them to OSHA. If OSHA asks for the plan, though, and this is kind of a short turnaround, you only have 4 business hours to do so. So if they ask for it at 9 in the morning, you don't have until the next business day, like you do with some OSHA records. You'd have to show it to them that afternoon. Now, if they ask for it at 4 in the afternoon and you close at 5, then you would have until the next morning to get it to them because you'd be able to count your actual business hours. But that again can be tricky. And I'll tell you, in the new administration, they are all about these records access issues. I've had a client already who was cited several $1,000s for not giving injury and illness records to the employee and their authorized representative within the designated period under the electronic record keeping rule. So this is another kind of gotcha that they have on the record keeping aspect of the rule. So now let me go through the frequently asked questions. Then I am going to cover the contractor executive order very briefly, a little bit more on the EEOC, long COVID, and then we will take your questions. So do stick around because we have this slotted to go until 10:30, and I definitely will get to your questions. So frequently asked questions in terms of the OSHA highlights. First of all, for those in the state plans, state plan states, yes, they are going to have to adopt a comparable rule. This is not one that is elective. This is mandatory. They have, because of the fast time track though, normally a state plan state gets 6 months to implement a new federal OSHA rule. Here, they got 30 days to do it, and they have 15 days to notify OSHA about their intent, which actually expires on November 20th. Rules that prohibit employers from requiring vaccines will not be considered, at least as effective. So, again, they did a shot over the bow to a few of those states that, were initially indicating some resistance to this, like South Carolina and Arizona. They clarified that you do count all employees in U.S. workplaces. So if you have 100 employees company-wide, but 45 of them are in the U.S. and the remainder are in Brussels, you don't have 100 employees in the U.S. But you are going to be counting all employees, including your home workers, including people who only perform work at customer work sites, for example, my electrical contractors out there, or who work at mobile work sites, office space or something. Even if they never come to your main office, if they are an employee and they're on your payroll, you're counting them. Now, you are not counting people from staffing agencies, and you're not counting contractors or subcontractors within that amount. Now, what about the gamesmanship? And I know you're out there because I've had clients already, I hate to say it, ask me, can we do this? You've got 104 employees and you say, well, fine, I'm just going to fire 5 of them and I'm going to have 99 employees when this thing, goes into full effect in January. Wrong, Kimosabe. This took effect November 5th. You're counting the number of people in your company as of November 5th. If you drop below, if you were above at 100 or above on that date, you're covered by the rule. And next week, if you drop down to 95 people, you're still covered by the rule. Now, if you were at 95 people as of November 5th, but you hire on people maybe for the holiday rush, and you go above 100 in your company, you're now going to be covered by the rule. So, don't think that you can play that numbers game and you're going to fire half of your workers to get out from under this and use temps. It is not going to work that way. If you have people working for you who are under the age of 18, they are covered by this. But remember, when you are talking minors, let their parents know that they're either going to have to be vaccinated or tested. They may decide not to work for you. If the parents decline consent, tough noogies, that worker can't come to your workplace. And so that is going to, again, be a little bit of a bump in the road, down the road. But again, the vaccine and the testing doesn't take effect until January. This is a bit of an irony here, by the way. The business community, they held 129 stakeholder meetings at the Office of Information and Regulatory Affairs over at OMB. And the business community was saying, oh, please talk to OSHA, don't have this take effect until after the holidays because it's going to impact our ability to hire people and remain in business. And so OSHA took that into consideration, and that's why they bumped this out to January 5th, right? And now, in challenging this rule, those states are saying, well, obviously this isn't a grave danger because they're able to delay the vaccine and the testing requirements until January. So this is a very bit of a disingenuous approach where they asked for that leniency and now they're using it against the agency. But that's how things roll in Washington. What can I say? So again, you do not count your temp agency people, contractors, etc., but you do count part-time workers, you count short-term workers, seasonal employees, and you count people who are excluded from the scope, including the outdoor workers, not only the home workers, but the outdoor workers. Now, what about franchises? This was another hot point of contention during that period of review over at OIRA. And again, OSHA conceded and gave a bone to the business community. Franchisees and franchisors are not going to be lumped together for the number of employees. The trigger will be their direct employees. So, McDonald's Corporation has over 100 employees. They're going to be covered by this. But a McDonald's franchise that maybe only has, 50 people on staff, they would not be covered by it. So this is going to be very much a case-by-case analysis, and there may be some McDonald's franchises that'll be covered and others that aren't, depending on the size of them. And I'm not picking on McDonald's here. I'm using that just as an example. The exemptions to the face covering requirements are also clarified by OSHA that vaccinated workers do not have to wear them. Personally, I think it's still a good practice, especially if you have a high number of unvaccinated workers in your workplace. If a person is working alone, they have a closed room, a closed office. They don't have to wear a mask if they're unvaccinated while they're in there. You have a lunchroom, a break room. If people are eating or drinking short term, they don't have to wear the mask. If they have to drop the mask for identification purposes, like I did going through airport security this week, not a problem. Building security, not a problem. You may have to also take your mask down, maybe if people are engaging in reasonable suspicion analysis. Your activities have made them think that you're under the influence, and maybe they want to talk to you without a barrier to see if you had breakfast with Jack Daniels or not. That would be a reasonable reason to take the mask off briefly. If you are wearing a respirator already, you don't have to wear a face covering, or if the use of a face covering either is infeasible or creates a greater hazard. But if you are providing respirators in lieu of a paper face covering, and they do define in here also what is a face covering. It's got to be multi-layered, hold it up, light doesn't pass through it. Even if you're using a gaiter, which, by the way, fun fact, they don't allow gaiters as masks on airplanes anymore. I heard them giving that announcement last night as I was flying back. But OSHA will allow gaiters, but it does have to be double layered. So if you are going to, though, use an N95, you can do that, but you have to implement a mini respiratory protection program, and the new standard for that is 1910.504. That is the same mini respiratory protection standard that was included in the emergency standard for the healthcare workers, by the way. So they're double dipping on that one. This is, I guess, good news for some employers. It will not be a violation of Section 11C in OSHA's view if you discharge a worker for refusing to get vaccinated and that employer has opted not to offer the testing option. So, if you're going to be, real hardcore about it, you can fire those people who don't get with the program. Now, people who have previously had COVID, they are not viewed as protected. This whole natural immunity, antibody, no. No. You still have to vax, you still have to test, according to OSHA. So fully vaccinated is your status 2 weeks after you've completed the primary vax sequence with the appropriate interval between your doses. And up until that point, even if you're partially vaccinated, you're going to have to wear a mask. You're going to have to be tested weekly. Now, this is the criminal stuff I was talking about before. An employee comes to you and they say, dude, I was vaccinated, honest, but I lost my card and, I can't get it from the drugstore. Okay. You can have them sign an attestation, and the language OSHA wants you to have in there is, I declare that this statement about my vaccination status is true and correct. I understand that knowingly providing false information about my vaccination status on this form may subject me to criminal penalties. And what they want them to include in there is, the dates of their vaccine, where they got it, the type they got it, in their affidavit as well. And again, if you are an employer and you conspire or collude to accept falsified documents, just like immigration documents, they're going to nail your hide to the wall if you do that. You have to make a roster. All employees, not contractors, not temps, but your own employees, whether each is vaccinated, are they fully vaccinated? Are they partially vaccinated? Are there any applicable ADA or religious accommodations that have to be noted on the roster? Are they not fully vaccinated or considered that because they have not given you acceptable proof? But all employees have to be accounted for on the list. And then the records, the copies of the vaccine cards and the test reports, the copies of the rosters, the copies of the aggregated reports, all of that must be provided to employees or their authorized representative upon request, and also to OSHA, again, for business hours is all you're getting on that. Unvaccinated remote workers do not have to test weekly, but they are going to have to test before visiting the work site. So if they're called in for, an all hands meeting or a safety class, for example, they can't just wear a mask and isolate while they're on site briefly or for that day. They are going to have the negative test. Now, persons who previously tested positive or had a diagnosis of COVID cannot undergo accurate testing for 90 days following the date of a positive test or diagnosis. So when they return to work, they're going to have to continue wearing a face covering. And then once it's safe to resume testing, they can do that. You don't have to remove somebody if they were only exposed to a positive person. They only have to be removed from the workplace if an employee themselves has a positive test or they have been diagnosed with COVID. And again, there is no contact tracing requirement under this rule. Anybody who is positive, vaccinated or unvaccinated, removed from the workplace, remain out until a negative test or they meet the return to work criteria. They've incorporated by reference 1910.509, which is the isolation guidance from the earlier emergency standard for healthcare. And there is no paid time off required if you have a positive test. Now, if workers have, accrued paid time off, obviously they can use it for that. And then if a worker is isolating with a positive test, but they're not ill, you can require them to work remotely. So it's not a free holiday for them. You have to keep a record of each test result, not just the vaccine records, but the test results for each unvaccinated worker and retain those through the period of the emergency standard. The worker pays the cost of that unless it is addressed by the collective bargaining agreement or it's necessitated because of the ADA or religion. You pay for the vaccine up to 4 hours of paid time off, regular rate of pay, not overtime pay. And you cover their time going to and from the vaccine site in there. Typically 4 hours will cover it all, but you don't have to reimburse them for the transportation cost. And if an employer has a bunch of people they need to have vaccinated, maybe you're one of our protein plants here on Delmarva, and you opt to bring in a licensed healthcare provider who can give the vaccine there for you, then obviously you're not having to pay the 4 hours of time off because they're not traveling to get the shot. You would be keeping them on the clock during the period that they go from their workstation to get the vaccine and then back. And then you would pay them for the reasonable time off for any side effects. But, it's not worth it, probably money-wise, to bring someone in to vaccinate 5 people. But if you have a bunch of people, that may be a good economy of scale for you. OSHA also in the guidance specifies the tests that you can accept, they are the FDA approved tests. They're the ones that you can get at the CVS and Walgreens. They have to be administered according to the authorized instructions. And if you are using the over-the-counter tests, the rapid tests, they cannot be self-administered and self-read. They have to be administered under the observation of the employer or using the authorized telehealth proctor. And like I said, it took about 15, 20 minutes to do that. Most of that, though, was the waiting period. And once you've taken it, you put it on the table and leave it there. You could do other stuff during that period. So you don't have to like sit there and stare at the proctor. But they do want to see the results of the card, and they want to check your ID and make sure it's you on there. So there are some good checkpoints, I think. The systems are up and running. And so for employers, there's really no reason you can't avail yourselves of those. So this is a summary here. This is, again, another good one to screenshot. By December 6th, you have to establish a policy. We talked about what has to be in it already. You have to determine the vaccination status. You have to provide the proof and maintain the records or the roster. You have to provide the support if employees want to go ahead and get vaccinated after December 6th. You're going to be paying for it, paying for the time off, and paying for the vaccine if needed. But again, usually it is free. You're going to require the notice of their status of a positive test or diagnosis and get them out of there. You're going to be requiring people to wear the face coverings when indoors or occupying the vehicles if they're not fully vaccinated. You're going to be training the workers, and there's no documentation requirement for the training, but undocumented training never happened. If the worker says, no, I wasn't trained on that, and you don't have a record, you're going to get cited. Also, you need to, again, remind everybody involved about the sanctions, criminal penalties for falsification of your documents, whether it's the vaccine records or the test results. Report the work-related hospitalizations and fatalities to OSHA using that revised criteria. That is as of December 6th, and also sharing your records and your rosters with the workers, their authorized representatives, and OSHA. All of that kicks in December 6th. And then January 4th, you're ensuring that workers who are not fully vaccinated have the weekly tests if they're in the workplace at least once a week or within 7 days of returning to work. And of course, the vaccines, you want to be encouraging that, now, really. That's what OSHA is hoping for. What about our friends over at MSHA? They are not covered by this rule, but just last month when the Senate adopted the labor HHS appropriations for the current year, we're under a continuing resolution right now, but they did require MSHA to report to Congress within 120 days of enactment, summarizing its plan to do an emergency temporary standard. And notably in here, they said this was needed because mine workers' lungs may already be weakened because of exposure to coal dust or silica. That silica, that should make a few people on the construction side nervous, because there are studies out there indicating that workers who have pneumoconiosis or silicosis are at heightened risk, A, for getting COVID, and B, for having long COVID or death. And remember what I said earlier with the long COVID, being accepted, A, by the Department of Health and Human Services now as eligible for SSDI, and now those conditions being adopted by the EEOC, recognizing them as covered conditions under the ADA. That does really have some ramifications, I think, for workers' comp down the road. Now, shifting gears here very quickly, the executive order, this applies to federal contractors, but it also applies to their subcontractors and to some service providers. So it covers more people than and businesses really than first thought. This came out on September 9th, and this is the vaccine mandate. The deadline for solicitations, applicability to those, is in our rearview mirror, October 15th. The contract award application deadline is November 14th. So that's coming up, in a couple of days. You do not have to terminate your unvaccinated workers, but only if you can find a job for them that does not involve working at all on a government contract or working in a covered contractor workplace. And that includes an administrative building with shared services. So if you have unvaccinated workers who normally report to an administrative building and they share payroll, legal, HR with your government contractor employees, then they can't. They either have to be vaccinated or they have to be gone. That's a big deal. And again, this is very different from the emergency standard protocols. The flow down on this and the contract size is determined by the simplified acquisition threshold, which is $250,000. And that's really pretty low when it comes to government contracting. All subcontractors on those contractors are going to have to comply with the vaccine mandates. And I already have, copies of letters that have been sent out to contractors notifying them retroactively that their contracts have been modified, and giving them no later than December 8th to be vaccinated. Now, that is what those letters that went out in the last couple of weeks said. But under this emergency standard, they were asked, again, by the business community to try to harmonize this stuff. And so they did kick the deadline out on this executive order to conform with the emergency standard on vaccination, the January 4th. So, again, you've got a little bit more time now to get that vaccine sequence in place, but they've got to be fully vaccinated by that deadline. So you gained a little less than a month, but get on it. And then there are, attachments that you have to include the substance of this clause in your subcontracts that meet that simplified acquisition threshold. If you sell a service to the government, or a business that sells to the government, you're going to be affected by this. So this is the tentacles that go out. It's not just the companies that are doing, the federal, highway projects, for example. It's more attenuated than that. You have to have vaccines. You do recognize, though, the ADA and religious exemptions. You're also going to have masking, physical distancing, and that's all spelled out in more detail than we can go into here today. You have to have a COVID safety coordinator if you're a federal contractor. And this is the executive order that we're talking about, 14042. That COVID safety coordinator has to monitor your contractor compliance efforts, the vaccine documentation, distancing, and masking. It applies to all employees working on the covered contract. It applies to employees like in-house counsel servicing the covered contract, and to your employees who work at a location that the covered employee is likely to visit. Again, that might be your HR building. It even covers your contractors who work from home. So this is very, very broad. There are reasonable accommodations that you have to offer for those ADA and religious exemptions, such as telework or an unpaid leave of absence. You have to engage in an interactive process with the worker. So who is covered under this executive order? Directly competitive contracts, sole source and limited source contracts, government-wide acquisition contracts, your GSA and your VA scheduled contracts, task orders. Grants are uncertain at this point. It's also unclear if you have no physical presence on any government work site and you're only providing non-labor services like data storage, whether you're going to be covered in the end. But right now, GSA is applying it to all of their contracts. And whether you can recover those costs for implementation is uncertain. If you have a cost reimbursement contract, you likely can. You also should look at your options for equitable adjustment and fees under your applicable federal acquisition regulations change clauses. And then indirect service providers to federal contractors may also be within the scope of this because they talk about it being in connection with performing the covered contract. So if the indirect service provider is essential to this, accounting, sales, IT, finance, contracts administration, legal, delivery, distribution, they're all covered by this too, those workers. But your janitors, your landscapers, the people who fill the vending machines, they are not critical to the performance of the contract. So therefore, they would be excluded from this. And even banks, if you have an ATM for your bank in a federal building, federal credit union, for example, or on a military base, you may be covered by this as well. Otherwise, just the fact that you are an FDIC approved bank, that does not bring you within the scope of the standard. So for federal contractors, this is just a checklist of things that you need to do now. I'm not going to read this to you. You can take a picture of it. And then finally, I wanted to note that the EEOC updated its guidance on vaccines, and the last update was just October 25th. This is another site you need to bookmark, but they are still of the opinion that mandatory vaccine programs are not prohibited, so it's okay to take that option that OSHA has offered you. And certainly for federal contractors, again, there's no prohibition on that, as long as you are respecting the ADA and the religious restrictions there. The long COVID, I just wanted to make sure we covered this. These are the conditions that they say any of these can be indicative of long COVID. So you're going to have an awful lot of people returning to work with COVID who maybe have tiredness or fatigue or brain fog, or they still have, continued respiratory issues, headache, vertigo, dizziness, heart palpitations, and arrhythmia. That is a very common side effect of long COVID. Another one is a condition called organizing pneumonia, joint and muscle pain, mental health conditions, PTSD. People who've been ventilated for a while in a hospital and recover from COVID, most of them have some level of PTSD, depression, or anxiety. Loss of taste or smell. Those sensory deprivations are covered under the ADA, and while they may not be limiting in most workplaces, if you're a utility contractor and you can't smell gas, that's a pretty big deal. And then, damage to your organs. So COVID has been a real, SOB in terms of the long, the residual impact of it. I know many people who have multiple conditions of these as a result of COVID. And so this is something you're going to have to accommodate in the workplace. And it may, again, if it's work related, end up with some fairly complicated workers' comp claims. Right now, under the ADA, the guidance says that unvaccinated workers are not automatically characterized as a direct threat to safety. You're going to have to do a fact-intensive and worker-specific analysis, and the employer has the burden of proving the direct threat to safety if they want to exclude unvaccinated workers on one hand. But of course, right now, the EEOC is saying, on the other hand, it's okay to have a vaccine mandate. We've got a little bit more explaining to do here, I think. Finally, and then I will take some additional questions here, of course, because I know I've seen them kind of rolling in a little bit here. The CDC says some individuals cannot get vaccinated right now. If you have a current COVID infection, you have to wait until you recover from that and your doctor clears you for it. If you have a history of MIS-A, which is a multi-system inflammatory system, you have to wait until you're recovered and at least 90 days from the date of diagnosis. If you've had the monoclonal antibody treatment or convalescent plasma for COVID that you've had already, you've got to wait 90 days after that to get the vaccine. So remember, we had some testing delays. Now we have some vaccine delays. And if you develop myocardosis or pericarditis after your first dose of the vaccine, don't get the second dose. Talk to your doctor. But they do recommend it if you're trying to get pregnant, if you are pregnant, and even if you're currently breastfeeding, because the immunity from the vaccine can be passed along in a positive way, and it is not a mutagen, it's not a teratogen where it's going to cause any birth defects or genetic changes. It does not keep you from getting pregnant. So if these things delay the due date for the vaccination and you're a federal contract employee, you can continue working, and you are allowed the leniency to get your first dose of the vaccine no later than 2 weeks after the clinical considerations no longer recommend the delay. So I know I've thrown a lot at you there. You can take down my contact info, and if I don't get to your question, certainly contact me, by email, and I'm happy to chat with you. So I'm going to turn this back now to our moderators, and let's see what's going on out there, because I don't really see the questions in this platform, but you can read them to me, and I'll do my best to answer them or tell you I don't know.
Thank you, Adele. As always, a wonderful webinar. This is Debbie Jennings with the Chesapeake Region Safety Council, and I'm going to read some of the questions that came in. As you all can imagine, we had a slew of them, and we'll give the unanswered questions to Adele, and she can respond back to them as she is able. First question, do you anticipate deadlines being extended due to the pending court actions?
No, because again, OSHA really needs to show a grave danger, and they've already seen how it's come back to bite them in the butt by giving the business community what they asked for, of making this effective after the holiday season, and extending out the deadline for the federal contractors. So I don't think they're going to make that mistake again.
Thank you. An unvaccinated worker that works exclusively outdoors or a mixture of working from home outdoors is required to attend a facility annually or biannually for training. Would they be required to show a negative test result?
Yes, if they are physically going to be in the building, and they are your employee, it is not enough for them to mask up. They would have to have a test within 7 days of coming to the facility. So a test from 2 weeks to 3 weeks ago is not going to count. And again, they can't just do a self-test and tell the employer, I tested and here's the box. It has to be monitored, either by the employer or by one of these telehealth testing companies that have risen up to meet the demand.
Next question, are there any written policy requirements for companies following EO 14042?
No, the policy, well, you would have to follow all of the aspects of 14042. And yes, I mean, you do have to have a policy because you're going to have a COVID safety coordinator who's going to be implementing your plan. But you don't have to have a separate plan for compliance with the OSHA standard. The plan that you put together to comply with 14042 will be accepted by OSHA.
Okay. For the non-vax group, the categories religious, medical, and by choice, do we have to track the offered explanation, or is it simply an unvaxxed statement suitable?
Well, there's different categories. If they are unvaxxed and they just say I'm proud and I'm unvaxxed, then, and you're allowing people to be unvaxxed, then they go to the testing and the masking, and you don't have to ask them, why, or get into a political debate with them. Now, if somebody wants an accommodation under the ADA or under the religious exemptions in Title VII, they are going to have to make that to you. The burden is on them to declare their status. You have the right to verify that they do, in fact, say have a health condition that qualifies them under the ADA. And only at that point does the employer have to give reasonable accommodation. So if somebody does not want to disclose that they have a reason for being unvaccinated that is health related, that's fine, but then don't expect that you're going to get a reasonable accommodation.
Okay. Are there any canned plan outlines available yet?
OSHA has a bunch of templates already on their website, and now that this rule, came out, I'm sure there's going to be lots of people coming up with templates. I mean, as a practical matter, we've been working with clients developing COVID plans even before this came out, and so if you work with counsel already, they can help you thread the needle on this if you need to. But the first place, as I said, is always going to be look at the templates and the forms that OSHA recommends, because that way they can't ding you for omitting something. If you design your own forms, you run the risk of maybe passing over something that needed to be included in your program or in your plan.
We've had a couple questions come in as we were just going over these last few, so I'm going to try to read them quickly. Our company is 10% office and 90% field. I am assuming the ETS would apply to the office, but training and communication of the ETS to all 100%.
Yeah, even workers who are in the field should be trained on the plan. Because workers can change their status. They might be working exclusively outdoors today, and then they break their ankle, and the next thing you've got them in the office alphabetizing files on light duty. So everybody needs to understand the company's program. I think that's just good safety training generally. But then those people who are exempt from it because of working outdoors or working remotely, they need to understand that, what they can and cannot do, including the need to have that test within 7 days if they are going to be functionally in there. The outdoor, they can, again, they've got a de minimis exception because, if they're indoor bathrooms, that somebody can use, they want them to be able to use them. They don't want them to have to pee against the truck, right?
Got it. How does testing / vaccine apply to outdoor construction workers who ride share in company vehicles while masked?
Yeah, because that is not considered being exclusively outdoors now. If you're sharing vehicles, that is one of the high transmission risk factors. For sure, you'd have to be masked up in there until you were fully vaccinated. But these are things the employer really has to take a look at. Giving a subsidy to let people travel by themselves, may be in the end more cost effective. And if they're sharing a vehicle, as I noted, but it's all with family members, I believe that is a continued exemption here as well. And those are some things, again, I'll note under the Virginia COVID rule, they have some fairly stringent things for mobile crews. You're really going to have to take a look at that if you're working in Virginia at all as a construction company or a contractor.
Okay. For religious accommodation, what type of document is acceptable?
For the reasonable accommodation, did you say?
Yes, for
Well,
religious.
yeah. They're going to that's a bit lesser level, by the way. Even the EEOC recognizes this. You've got to do more to accommodate disability or health reasons than you do for religious. Religion, they would have to, it has to be a real religion. It has to be a deeply held belief. And the religion has to actually, prohibit vaccines, The religion can't prohibit testing, by the way. I mean, you can't get out of both of them. But right now, there really aren't. The major religions, they're all advocating vaccines. The Vatican, you have to be vaccinated to go in the Vatican. So Catholics can't raise that. Jews can't raise it. Most of the major Christian faiths, again, have said they have no opposition. And the one, and I want to be clear on this, because stem cells have been used in the development of some of the vaccines, that is probably the one hook. But there are a number of major medications that are used over the counter as well as prescription that also were developed using stem cell research. And so an employer can have a worker on the religious exemption do an attestation that they are opposed to taking the vaccine because of the stem cell research, but then they also have to attest that they have not used and do not use any of these other medications. And it's everything from Tylenol to Tums and everything in between. I mean, stem cell research has been used for a lot of medications. So if somebody, has a deeply held belief about the COVID vaccine religiously, but it doesn't extend to these other medications, then that would not be valid and the employer would not have to accommodate.
Okay, and the last question is, we have service contracts that on occasion have our employees visit a federal contractor site to perform service or installation work. Is there a dollar amount that indicates we are a federal contractor, or is it the contract itself?
Well, the contract amount is $250,000. And then what you would need to look at is you're coming to a federal site. Are you part of a larger GSA or VA contract or a construction contract? Because if that is at the 250,000 threshold, even if you're coming in and doing, $20,000 worth of work, the way I read this and the guidance I've read on it so far under 14042 you would be required to come under that and be vaccinated.
That's all of the time that we have for questions today. As I mentioned before, we will give all of these questions to Adele and she can address them either on our website or in direct response to the person that did the inquiry if we have that contact information. Thank you, everybody. It's been a wonderful morning. And I just see that Dave Medeiros popped up. Dave, do you want to say anything?
I just want to say thank you very much, Adele. That was a ton of information you covered, and wow, a lot to that work for us to do. So thank you very much. I appreciate your support as always. Thank you.
Thank you. And I will just add one final thing. I saw a question pop up about how do you submit comments on this proposed rule part. And I've given you the docket information on the slide, but you just go to www.regulations.gov, and that is the portal. And then you can find the OSHA rulemaking docket from there. So good luck to you. Thank you so much. Everybody stay safe and be well.
All right, have a great day. See you all.